Well, after months of battling the COVID-19 pandemic, New York's governor announces the state's first tentative steps towards reopening. Governor Andrew Cuomo says several regions of upstate New York have shown progress in taming the coronavirus outbreak and are ready to gradually restart economic activity by the end of the week. Joining me now on Skype to talk more about the impact of reopening and what it could have on the spread of the COVID-19 virus here in the U.S. is Dr. Mark Strand, professor in the North Dakota State University School of Pharmacy and Department of Public Health. Dr. Strand, welcome back to the show.
Thank you.
At least 31 states have partially reopened so far, and I know there were initial concerns that perhaps things were moving a little too quickly. What are we seeing across the country in terms of the number of cases reported, and is that something that can be tracked accurately?
Yeah, we've seen when we sort of peaked out on April 24th nationally in terms of number of cases per day at 39,000, we've seen a 33% decline over the last 2 weeks, which is a sign that the social distancing and shelter-in-place orders have been working. And I believe the numbers are quite accurate. We have had a few months now to track the numbers. So I'm confident that the fact that we've been able to keep this suppressed has been a sign of success.
What are you seeing there in North Dakota so far?
In North Dakota, we're able to see the numbers under control with sort of an endemic level of 30 to 40 new cases per day, but there hasn't been any spikes. So we feel like our contact tracing and our overall testing measures have been effective.
I know when you were last on the show, we talked about the role that contact tracing, that is going to play on going forward in controlling the spread of the virus. Where are we on that front?
Every state is trying to recruit and hire contact tracers. As of now, North Dakota is the only state who has a sufficient number to meet the need. But it's really critical if we're going to keep these small clusters that emerge as we reopen from becoming outbreaks. So contact tracing can't be overstated.
One country that didn't require its citizens to shelter at home is Sweden. It issued no mandatory orders. What are we seeing in their battle against COVID-19 right now?
Well, it hasn't turned out the way the early reports suggested. Sweden has gone on to have 322 deaths per million people, which is much larger than neighboring Norway, which had shelter-in-place orders. They only have 41 deaths per million, and twice as many cases per million in Sweden as in Norway. So they have definitely paid a price in terms of cases and deaths for having not been willing to put in place shelter-in-place orders.
Dr. Strand, we don't have much time left, but I'm wondering if you have any final thoughts when it comes to the pandemic and what you think our viewers should know.
Well, definitely, as we begin to reopen, it's important that we still do so with caution. I recommend wearing masks and still ensuring 6 foot of spacing with people when you're in public. And so definitely we would want to continue to implement social distancing practices and good hand hygiene moving forward.
Okay, great. Well, Dr. Strand, thanks for coming on the show again. We really appreciate your insight. Dr. Mark Strand, thanks again.
My pleasure.